I think we've really all, in our clinical settings, seen a huge rise in prescriptions of GLP-1s. And for those folks like me who take care of pregnant women and pregnant individuals, we also see that. So I think one of the biggest sort of frameworks when we think about this is that many pregnancies are unplanned. Many pregnancies happen, without intending for a pregnancy to happen. And a lot of times there's, inadvertent or unplanned medication exposure in those pregnancies. And this is definitely one of those medications that we're seeing quite frequently now that patients come to us and say, "Hey, I've been on this for the last year. I didn't plan on getting pregnant, but here I am. What are the risks? What's going on? What should I look out for during this pregnancy?" And right now, we have some answers to those questions, but a lot more work needs to be done to better answer them. So this work really is the start of that, which is to just look at the prescribing trends around the time of pregnancy for us to understand how big is this exposure happening before and after pregnancies or kind of in this, perinatal period, is what we're seeing clinically kind of, supported by the evidence out there for prescription use.
The database that we're using here is called Trinetics. And this is a massive research database that pulls together de-identified electronic health records from a ton of US hospitals and healthcare systems. So we're talking about more than 100 million patients in the US. And people sometimes hear Trinetics data and all these different types of administrative databases, and they're thinking that, we're collecting data from patients, like a cohort study, but actually, this is a retrospective cohort study. It's not like a prospective one where you're collecting data in real time, right? Like the medical data is already here. This is routinely collected data. So every time someone in the US sees a doctor, they fill a prescription, they get a diagnosis, and it ends up in the medical record. And we're talking about like Epic data, for example, and makes it into Trinetics. What's particularly unique about the Trinetics database is that it's updated weekly, sometimes even more frequently than that. For a lot of other databases, you have to wait like years for the data to be ready for you to analyze. And by then, you already have a lag. So, with this gigantic national, almost real time database, we have timely access to prescribing trends without waiting for long periods of time to get this type of data. So this allows us to also look at people who are insured and uninsured and in all sorts of other forms of payer status. So we have a really large national sample ultimately. So what we did with the sample is we pulled people who were pregnant. We found everyone age 25 through 50 who had a delivery between January 2019 through the middle of 2024. And then we checked their prescriptions. When you have Epic data or EHR data, you're able to see their linked pharmacy records. So we tried to see if they were getting GLP-1 medications filled. We looked at the year before delivery, we looked at the year after delivery, and then we tracked trends over time. We grouped deliveries into 6-month periods. So it's like 12 months total, right, between 2019 and 2024. And we calculated the percentage who got medications in each period. So we had around 60,000 to 72,000 deliveries per 6-month period during this window. And then we used really cutting edge statistical modeling to pinpoint when prescribing started accelerating. And what we found ultimately, the key finding, is that prescribing rose from essentially zero in 2019 to 0.55% before delivery and over 1% after delivery by 2024. So this translates to roughly 20,000 pregnant people were exposed to GLP-1 medication in 2024 alone, if we were to extrapolate to all US births in the data. We got the hunch that somewhere between January 2021 and August 2022, we started seeing an inflection point in terms of the prescribing accelerating. And you might think to yourself again, like 0.55%, like 1%, that's not a whole lot, but again, like 1%, we're talking about like 20,000 people, and we're already, it's 2026 now. So this data ended in like 2024. So if I had to guess, we might be at an even larger number at this point.